Okay, here we go again. This is my third time. So we're going to give this a shot here as we talk about Chapter 1, and then I'm only going to do Chapter 1. As we look forward to taking your ATI, the first thing I want to say is believe in yourself. Take a deep breath in, let it out, relax down your shoulders, and let's take a look at Chapter 1. Now, before we go into ATI review, what I do want to do is remind you that there is the personal printout of your performance. Remember that as you are doing your ATI, that personal printout is about your strengths and your weaknesses. So keep in mind that that's there for you to be able to focus your studies. And also remember, as it says on page 1 of your ATI, that the real focus of medication administration as far as being prepared for the NCLEX are safety and infection control, and then the therapies, administering the therapies safely. So we're talking about knowing adverse reactions, contraindications, dosage calculations, as well as administering them safely. So keep in mind that there's really that sort of picture. And with each drug, focus on what is important for that drug, that medicine. And so going into Chapter 1, let's talk about pharmacotherapeutics and routes of administration. And so it gives you the different routes: oral, IV push, sub-Q, those sorts of things. Now, here's where we need to keep this in mind, is when we're looking at absorption. For example, you're trying to relieve pain, and so in the hospital policy is that when you're giving a pain medication, you assess pain at administration of the medicine, and then afterwards to assess its efficacy for that patient. Assess, 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 assess is so important in any nursing intervention. You know that's the first part of the nursing process. So we're giving that pain medicine to your patient. You choose to give a hydrocodone acetaminophen orally. You're going to give that drug. When do you reassess their pain level? About half an hour or an hour later, because you know it's not going to take effect right away. However, you're giving hydromorphone IV push. You're going to assess that pain within 15 minutes because you know that the onset is quicker. So it's important to understand not only the route of administration, how it affects the therapeutic desired state for your patient, but also we need to be able to think about the time of onset for things like insulin. You know, you have your fast-acting insulin. You need to give it with a tray in the morning right at 8 o'clock because it is fast-acting. It works within 15 minutes. So when you give that fast-acting insulin, you need to make sure that patient eats. You also know, however, that there's that insulin that has that longer therapeutic range for all day, and it keeps that level equal throughout the day. So that patient, it isn't as critical to make sure that they get that food because they have an even level as opposed to the spiking insulin levels. So really, as you're looking at absorption and the distribution across the body, being able to use those types of assessment data to be able to support your safe administration of medications is vital. Now remember, at the end of the chapter, there are those questions that will support your experience for reading Chapter 1.